In today's Health Smart, we are talking about the so-called resting sad face. New studies now say if you have a sad, depressed-looking face, that could translate to your emotional state. For example, someone born with a mouth that actually points south at the ends, making them look like they have a frown, can actually develop anger or depression.
All right, joining us to talk about this is cosmetic surgeon Dr. Dr Rivkin. Doctor, thank you for being with us. So first, let's talk a little bit about the research, because does the research find that depression is what, or that our sad face causes depression, or did it find that just Botox and cosmetic procedures make us happier if you are depressed? Because I was a little confused reading the research.
Right. So there's two different things, right? So there's this kind of concept of resting sad face, and then there's this concept of depression. So we think, okay, how we think of emotions, right? We think of emotions as being kind of projected onto the screens of our face. But what if it was not, what if it was more complicated than that? What if the expression of our face affected our emotions as well? And that's what we've discovered as we have had patients who have depression and they've been treated with Botox between here, and they can't do this, like right there, so they can't go around like this all day long, which some people do. And you think that going around like this all day long is just because you're sad, but not necessarily. Doing just that makes you sad, and so makes you a little, it amplifies your depression to some degree. And they found that you put Botox in here, acts like the same kind of effect as an antidepressant. Scientifically, like with randomized controlled studies, and it's a facial feedback hypothesis, it's called. The interesting thing about it is that it's not new. You know who came up with it? Darwin. So that long ago, Darwin noticed that, you know, it's not just emotions affecting the face affects the emotions as well. So changing certain things can affect how you feel. And that's really interesting to us.
Do people pick this up by seeing their reflection?
No,
like
it's
in a mirror.
No, because you think, oh, you know, this is because sometimes you think about these procedures and it's like, oh, this is just like foo-foo vanity kind of stuff, like Botox and fillers and stuff like that. But it's not. It's really how. So part of it is this kind of tension, this muscle tension, sends a signal back to the brain, and it affects how you feel emotionally. But then the other part of it, which I think is also interesting, is that people who, and this happens with time, people, like let's say, okay, so you say you have someone, let's call her Happy Heidi, right? Happy Heidi, going through her day, she's got a good marriage, good job, great dog, everything's
it's
fine,
all about the
right?
dog.
It's all about the dog. She's got her dog's great.
It is at this TV station.
And so you have this person who goes around, but as she comes out of her house, people look at her now, but they didn't used to, but now they do, and they say, what's the matter? You know, are you okay? Is everything okay? And she's getting coffee at Starbucks, and they're like, oh, here you go. You know, they have this like expression on their face, like, oh, here you go. And so she expresses she experiences the world as a somewhat sad place, because we're wired to mirror facial expressions. Like you smile, somebody smiles back at you. You're sad, people are sad back at you. And so you experience the world differently.
So let's cut to the chase. You focus on non-invasive procedures. What can people inject or do to cure their resting sad face?
So, good question. And you don't need surgery, which is nice. So what does that mean? When your mouth turns down, what you can do is turn it up to some degree with fillers and with Botox. When your brows come down over here like this, we can bring them up with Botox. When there's furrows over here, we can make those furrows less with Botox and with filler. So we can do all these things, and they're subtle little things, but together makes someone's face look happy, and then suddenly people aren't coming at them saying like, oh, what's the matter, and trying to express sympathy for this problem they don't have.
Now, once you're done with these procedures, do you find your clients are happier?
It really is amazing, because they'll come in, they'll say, this has changed my life. People don't come up to me on the street randomly asking me what's going on. So I'm a lot less sad because people are a lot less sad towards me.
Or anecdotally, I feel a lot better after my Botox. So that's speaking for me. For more information about Dr. Rivkin and his services, head over to westsidemedicalspa.com or call the number on your screen. You can also follow Westside Aesthetics on social media. Doctor, thank you so much for being here.
Thank you very much.